Prior to menopause, we are well protected, and arterial disease is less likely to occur in women under the age of 50, and it's thought to be due to hormonal reasons. Once we reach menopause and thereafter, we catch up to men as far as our risks of developing arterial disease down the road. And that arterial disease could be carotid disease, it could be aortic aneurysms, it could be PAD or peripheral vascular disease. One of the biggest risks in both men and women is smoking. So if you smoke, it's imperative that you quit, because you have an increased risk of developing arterial disease as you age. We know that arterial disease is underdiagnosed in women. We don't really know why. Is that because we don't seek help early enough? Is it because when we do go to our doctors, sometimes tests aren't as ordered as quickly? We're not sure. Sometimes we're so busy that we notice little aches and pains and we might not go to our doctors to complain about them. Yet they could be showing that there's an underlying problem that needs to be worked up and treated just the same. If you've been diagnosed with PAD, it's important to do the risk factor modification, meaning to have you stop smoking if possible, and to do your very best at that. Nutrition is extremely important to make sure you're eating right, make sure that your cholesterol levels are brought down to a normal range, and sometimes that means that you may have to take medication for that to help reduce your risk of stroke and heart attacks long term. And when PAD is discovered, we know that it is a systemic problem. So it's not only in the heart or only in the coronary arteries, but it can also be throughout the body. We generally will work up what's bothering you the most. For example, if you're having trouble when you walk, then we'll do a blood pressure cuff test to look to see what the arterial circulation is like. If you're having trouble using your arms a lot and your arms get tired, or if you've noticed that you've developed sores on your digits, whether it be your fingers or your toes, these are all things that we need to make sure that there isn't a blockage or an arterial blockage that's causing this problem. If we find one, that can be treated either with a balloon or a stent at the time of an angiogram, which is used to diagnose the arterial disease, or sometimes we have to do what's called a bypass. If you need a bypass to improve your circulation, then we'll talk to you about where the blockages are and what we do to create better blood flow, whether that means to use your own vein to plug in above the blockage and below the blockage, whether sometimes we use specialized tubing and material called PTFE that allows for a channel so that there's better blood flow around the blockage. This can all be done. And whether, again, it's done for lifestyle, so in other words, you're having pain when you walk, whether it's done because you might have a lower extremity ulcer or what we call rest pain, where you don't have enough blood flow at rest to get to your feet, this can all be treated. Those patients, or if you develop an abdominal aortic aneurysm, as a woman, you have the same risk of that rupturing once it gets to a critical size. We can work that up with the appropriate diagnostic testing, usually starting with something non-invasive such as an ultrasound, or a CAT scan can be done to better define the anatomy, and then we can treat that operatively, whether it mean by open surgical techniques or by stent grafting that we can do, which is minimally invasive. It's really important that when you do have questions about how you're feeling, to go and seek medical help. Sometimes we get so tied up in our lives and running around after our children and taking care of everybody else. It's important that we also take care of ourselves.